the patient's right and responsibility. And this topic is not much discussed in the medico legal webinars. And I'm sure most of us, we don't are not fully aware about the patient's rights and responsibility. And this holds true for me also. Till I was going through this uh, for preparing this presentation. In the current era, patients' rights are receiving more and more attention by the public and legislation. Awareness of the patient's right and responsibility is evolving rapidly, mostly due to the development in the medical science and the technology, and also access to the information on the Googles. The peoples are now aware about the disease, the diagnosis, the investigation related to them, and the various treatment options with the prognosis. So, as a part to be there, the patients are now demanding to be involved completely in the process of treatment and the uh, investigation. Next, it is important uh, for we doctor, why should we know about the patient's responsibility and rights? And learning this, having the knowledge and the understanding about the patient rights and responsibility is a lesson to learn and practice the ethics and human rights. And it will make the profession more transparent and receptive. The learning to knowing the patient's rights will provide a high quality service to the patients with the equity, non-discrimination and dignity. And
Aja?
a clear understanding of the patient's right will make the health related profession more process and the profession more stress free and more organized. Modern healthcare can function better when both the patients and doctors become a party together. Indeed, this kind of the cooperation between the two will have a positive effect, and it will avoid the fear, it will avoid the litigation. Let's understand who is a patient. In Indian law, the word patient is not defined. And however, this term covers the people who receive the healthcare service by the doctors or the medical profession. Uh, let's also understand what is meant by the patient's rights. WHO has defined the patient right as those owed to the patient as a human being by the physician and by the state. The origin of the patient's right is based on the duties of the doctor and nurse towards the patient according to the Code of Ethics of Medical Council. And it consists of enforceable duties that healthcare provider and not only the healthcare provider but the healthcare business persons also owe to the patient to provide them service, and also the benefit has to be there to the patient. So it's not only simply a privilege, but it becomes a right to receive. And if it is not received, we all should be knowing that the provision of legal intervention is there to help and support them. Now, a brief history about the evolution of the patient rights. It was in 1970 when the American Hospital Association came out with the Patient's Bill of Rights, which was revised with the list of the 12 rights in 1992. And there was a multiple variation in the rights as per need of the particular patient's community from time to time. In 2003, the Patient's Bill of Rights was replaced by the Patient Care Partnership, and it included the high quality care, the clean environment, privacy, involvement in self care, and the treatment. A sweep change came in 2010 when the President Obama came out um, two important announcement to protect against the health insurance, and this was to include the pre-existing medical condition and to get the preventive health screening without any extra fee or copay, and it came into force by 2014. In 1990, the UK introduced the patient charter, but soon it was replaced by the NHS Constitution for the England in 2013. 1995, the World Medical Association revised this Declaration on the Patient Rights of 1979 as a charter on the rights of the hospital patients. So we see that all over the world, different countries have their own declaration on the patient rights. Now, there is no specific legislation covering the patient rights in India. There are various provisions related to the rights and in the various legal documents and the acts which are shown here, like the Constitution of India, 1950, Indian Medical Council Regulation 2002, Drug and Cosmetic Act 1940, Clinical Establishment Act 2010, Indian Penal Code 1860, and the Code of the Criminal Procedure 1973, and including the Consumer Protection Act from 1986 to 2019. Now, it was the National Human Rights Commission, along with the Ministry of Health, Family Welfare, who had um, included and who adopted and drawn upon all these various provision on the as I have mentioned in the earlier slide, along with the International Charter on the Patient Rights and the various judgments from the Supreme Court and the NCDRC, and they came out first time and framed with the frame of the documents in India as the Charter of the Patient's Rights. Initially, it had the 17 patient rights, and it was put into the public domain in 2018. But it was finally came in March 2021 by the National Health Authority, along with the Ayushman Bharat Prime Minister Jan Arogya Yojana, as a patient's rights and responsibility charter, which includes 9 patients' rights, and it is as a guidance to all the impaneled hospital, whether the private or the government sector, to make their own individual standard protocol and SOPs, and to see that it is implemented with the main 3 goals, that is to assure the fair working of the healthcare system and whether it is meeting the patient's needs, to create a strong relation between the patient and the healthcare provider, and provide a way to the address the grievances if the patients are not happy and satisfied with the care service. The other objective also include the active participation of the patient in informed consent and decision making, along with the education and awareness about the ABPM JYA. Now, these are the 9 patient rights in the India, according to the our patient charter, responsibility and rights, and these are shown here, and I will be dealing one by with all of them one by one. The first, most important, is the right to information. The treating doctor and even his assistant can has a right and has to provide the adequate information about the illness diagnosis, the proposed investigation. The diagnosis can be the provisional or the final, with along with the investigation, the treatment options associated with the possible complication and the side effects of the medication in the simple language with the patient understand. If the patient is not in the state of mind or is insane, then this all information has to be provided to the caretaker or the attendee along with the patient. The patients, if they refuse to the allopathy treatment in favor of the other alternative treatment like Ayush, where they can go for the Ayurvedic, Unani, or homeopathy treatment option, then the same should be documented, and then it is the responsibility of the lies on the patient's shoulder if any harm or worsening of the illness is occurs due to the refusal of the patient. It is important to provide the facility, the service of a translator or the interpreter to facilitate and understand the communication if the patient doesn't understand the local language or the English. And also the other most important information to be provided is they have a right to know the identity, the professional status of the treating every doctor in the team, their assistant, and who is the primary doctor. The expected cost of the treatment has to be provided to be informed right from the beginning, and it should be preferred in the writing. Now, it should be item wise, and the transparency should be there in informing the um, treatment cost, which should include the hospital service charges, the bed charges, the ICU charges, and along with the expenses of the various investigation, and like the CT, MRI, or the ultrasound, or the PET scan, the various implant in case of the orthopedic or the eye surgery, and the procedure is specific cost of the treatment should be always informed to the patient in writing. And it is also important to note that the pricing of the medicine and all these medical implant should be never higher than the MRP as per the national list of the essential medicine, which is being kept by the National Pharmaceutical Pricing Authority. The next is the record and the reports. Now, the patient has a right to access the original copies of the case paper, indoor paper records, and investigation reports as per the rules. And the once if he is admitted, the investigation report copy should be available within 24 hours of admission or even 72 hours after the discharge. Hospital is bound to provide the discharge summary, and in case of the death summary to the caretakers or kin, any next kin of the patient with the original copies of the test report. As per the MCI, the indoor records are to be preserved for at least 3 years, but as per FOXI for 5 years from the commencement of the treatment, and other like the record of the MTP MTP patients, record of the PCPNDT Act, and ART Act has to be kept in record as per their rule. And if the patient requests for the documents, then it has to be supplied within the 72 hours. It was a in case of the VP Santa versus Cosmopolitan Hospital, the Supreme Court has said that the denial for the X-ray film is the deficiency of the service, as the patient has a right to know the nature of the fracture. This is just one example. Um, Now, the other important right is the access to the medical care. Every patient has a right to the life and the personal liberty according to the article of 15 of the 21 of the Constitution, and it is the fundamental right according to the article 15 that there should be no discrimination should be done based on the type of the illness what the patient is suffering, the HIV status, the gender, age, caste, ethnicity, sexual, or the linguistic or the social origin. And according to Clinical Establishment Act 2010, they have to be the provided the appropriate treatment according to everyone without any discrimination. Though every doctor has a right to choose the patient, but according to the NMC Ethics Regulation Section 2 and Clause 11, But this rule doesn't apply in case of the emergency, natural or the man-made disaster, or during the public health emergency. And this all we have seen during the COVID period. Also, the selection of the patient is not applicable in any hospital setup. It is the responsibility of the treating doctor, whether he is in the private or the hospital sector or running in the private nursing home if is on, to provide a prompt emergency treatment in life-threatening condition without delay and not compromising on the quality and safety irrespective of the paying capacity. The life-threatening condition is meant by obstruction in the airway or the hemorrhage going in the road traffic accident to stop it, and any medical condition in which the threatening to the life is there. They should be treated any uh, without any compromising with the quality, and without any paying capacity. This is a very important landmark judgment for the in case of the permanent Katra versus Union of India, where the emergency medical care to the victim of the road accident, and the every patient or the victim of the road accident has to be given the cost, the treatment free of the cost, till as an emergency, till his basic life-saving treatment is done. And also the everyone is well aware about the very famous case of Dr. Chandra Prakash versus the state of Delhi, though the case started in 2003, but the announcement and was came in 2012. And after this, and this was the case where in a road traffic accident a young person was denied to be get admitted in the ICU just after giving the emergency medical treatment in the beginning due to the lack of the paying capacity. And after this case, the 25% beds are reserved in every hospital for poor and needy person to provide immediate treatment even in the absence of fees or once the stable arrangement is done before shifting to the other center. Uh, Another very important right of the patient in the current area to have the informed consent before undergoing any invasive investigation, surgery, or chemotherapy. Uh, it is the duty of the doctor, treating doctor, to provide all the detailed information before the start of the treatment about the nature and procedure of the treatment, what is the purpose of the treatment, the benefit associated and the side effect associated with the treatment, and to provide the alternatives of the treatment, like in case of the AAV, whether all the options, the surgery versus the Mirena insertion or the hormonal treatment. In case of the hysterectomy, whether they have to go for the abdominal route, open route, or through the laparoscopy or vaginally, and the choice of the treatment, to select the treatment choice is always on the shoulder of the patient. It is the autonomy of the patient to choose always the autonomy of the patient to choose the treatment, and the involvement of the patient in decision making feels him to be empowered, and it develops a good cooperation between the patient and doctor relationship. Now the everyone is well aware about the famous case of Samira Kohli versus Dr. Prabha Manchanda, where the Supreme Court has given all the detail about the various aspects of the consent. It's also important in case of the um, uh, children below the 12 years, and also in the mentally ill patient, the informed consent has to be provided and taken by the relatives or the attendant who is accompanied. Uh, Confidentiality, dignity, and privacy. It is the legal right of every patient to have the confidentiality as per the code of ethics, and all the information about the illness, the treatment plan should be strictly confident from everyone except the patient, and a permission of the patient has to be there before the disclosure. The except in the cases when it is asked by the law or by the third party contractual agreement, as in case of the insurance policy. And this is confidentiality is not applicable in case of the mass public interest to protect from the infectious disease. It is also important for the hospital administration to provide a female attendant to protect her respect, privacy, and dignity during the examination and treatment by a male doctor. And to maintain the dignity, and the hospital has to ensure that all the data regarding the patient illness and the treatment has to be confidentially secured, and he has to ensure about the security of all the data also. This was an interesting case where a male young doctor from Nagaland was accompanying a patient to Chennai Apollo Hospital for aortic stenosis surgery, aneurysm surgery in 1995, and he donated the blood. He's married, and after the treatment, the patient has gone back, and this doctor marriage was fixed 6 months later. But then it was cancelled as the girl's family came to know from the hospital about his HIV positive state through the Apollo hospital. So the doctor filed the case against the hospital in state council and later in the Supreme Court also. But the case was dismissed by the Supreme Court in the interest of protecting health and right to the life of the uh, patient. Now, it is the right of the patient, according to the Clinical Establishment Act 2010, to ensure and seek the second opinion. And the hospital administration responsibility is to provide copies of all the medical files and reports without any additional charge or delay. It is also when the patient is asking for the second opinion, there should not be any compromise on the quality and discrimination in the treatment of the ongoing treatment, and the treatment should never be stopped. It is again the responsibility of the hospital to provide a hygienic environment in the hospital by giving the proper infection control measure, the safe facilities for the safe drinking water, the sanitation facility, the wastewater and garbage disposable facility according to the standard of NABH, and failure to ensure the proper standard care and safety and protection is the service deficient on the hospital's side. The patient can also seek the legal redress and compensation for the service deficiency using the CPA. Now, recently, it is also important to know that while using the various drugs like Lassa, look alike and sound alike, we have to be careful if any mishaps or uh, uh, harm to the patient's life occurs. Also, while this thing, when we are treating the two similar patient of similar name of the patient, the identity of the patient is very important to differentiate between the two patients before we provide the treatment, especially in cases of the chemotherapy of the cancer patient. Now, this was the main interesting report on the Twitter, where a 32 years old man died after he got stuck into a MRI machine at a hospital in Mumbai, and the case was filed against the hospital, the doctor, and the um, um, GDA who was taking the patient, who allowed the patient to attendant to carry the oxygen cylinder along with the patient in the MRI room. Uh, Now the proper referral, transfer and continuity of care. Whenever the patient is discharged, it is the duty of the treating doctor as a part of the continuum of the care to advise in all detail the treatment along with the lifestyle change in the diet and also the emergency contact number where to report in case of the emergency. Also, the advice regarding the regular follow-up checkup should be advised in the best interest of the patient. Whenever the patient is transferred or referred to the another hospital, the patient should be informed about the treatment and
There is some
Some internet, I think
issue,
not. Internet,
internet issue.
yeah, it's
Yes.
frozen. Should I call her?
मैं करूँ कॉल मैम?
Dr. Leena कर रही है, I think.
also the duty of the hospital
Yes, she will
administrator
be back.
to assist the patient during transfer. Just a minute.
Dr. Leena is calling you for that.
I'm taking the second opinion from the another hospital doctor. Now, the caretaker has a right to give the feedback, comment, and complain about the treatment cost, quality, health facility, even after the discharge. And they should give the complaint with a registration number so that it becomes easy to trace and to see whether the resolution of the complaint has been done or not. And this the complaint can be done to the MS of the hospital, the special grievance officer whose name is displayed in the hospital. Now, the district hospital officer or the deputy director of the health services at the state level, and the special internal redressal officer or the team appointed has to investigate, suggest, or take action which has to be communicated to the patient within 15 days of complaint. And the patient can file the case within 2 years from the cause of action at multiple places at the same time. It can be at the medical council, consumer forum, civil court, and etc. Now, we have talked a lot about the patient rights. Now, let's have whether the patient also has the patient responsibility to the healthcare provider or not. The honesty is the first and foremost responsibility of the patient. He has to provide the accurate and complete information to the best of his knowledge and give as much as information about his present illness, the past illness, the medical history, the family history, the allergy, and the other relevant details, and also the treatment taken in the past. Now, the other important responsibility is the compliance to the treatment. The patient has to cooperate with the doctors during the examination, the various diagnostic, undergoing the various diagnostic tests. He has to follow the diligently the instruction, the advice, and the agreed treatment plan. And it is important that they should keep the appointment if in time, or if not possible, then they should notify the hospital as early as possible. And if the treatment and instruction is not followed and refused, then they should be ready to uh, have the consequences of the refusal. The other responsibility of the patient is to be the transparency. It is not very uncommon uh, to see for the patient to ask and take the false certificate, to provide incorrect information, especially during the TPS form fill-in, because they have not disclosed it during the insurance. And this, if they are not satisfied, they should discuss the outcome of the treatment by the from the treating doctor, and they should make all the effort to understand the medicine prescribed and other compliance to for the effective treatment outcome. And it is the duty, responsibility of the patient to inform the doctor if they want to change the doctor in the same hospital or they want to go to the other hospital. The conduct of the patient is the reflection of his humanity and the nature. They should follow the hospital rules which are displayed at the various places in the hospital premises, like waiting with the patient, making no noise. They should not smoke later, keep the environment clean by using the garden means. They and the children below the 10 years should be avoided in the as a visitor in the hospital. They should respect the dignity of doctors and other healthcare providers as human beings and as profession. Refrain from the physical assault to the healthcare provider. Refrain from the misbehave and misconduct if not satisfied with the doctors on the line of the treatment, and avoid the medical terrorism. They should do not resort to the violence in any form, damage or destroy any property of the hospital in case of the grievances. They should take care of their valuables and belongings, and they should also be considering to the respect and dignity of the other hospital. And it is the patient should be made aware that the assault of the doctor and damage to the property is a criminal offense under the daily Medicare service personnel, and this and it is a punishable and up to the jail of the 3 years, and they have to compensate the amount, double the amount of the damage done to the property. And this should be displayed at various vulnerable places like the labor room, the OT, the ICU, and the emergency room. To summarize my topic, uh, um, it is the essential, the patient are the essential aspect of the healthcare system, and the accurate information about the patient right and responsibility is the first step toward the patient-centric approach. Patient also has a right to receive the quality healthcare service, access to all the information about their medical condition, protect that with privacy and confidentiality. They have to provide the accurate and complete information, follow the instruction given by the healthcare provider, and also respect the doctors and all the others. Their rights are important as it empowers every patient to participate actively in their healthcare decision making process, which promotes the trust and confidence in the health. Lastly, if the doctors learn to respect and care for the patient's right, then this should be definitely returned back with the respect of the doctors, respect and dignity of the doctor also. Thank you very much for the patient hearing.
Thank you very much, Dr. Raj. That was a real, very nice presentation on patients' rights.